Hello, I'd like to introduce the Series 5 chair from DCI. The Series 5 chair is fully hydraulic. The two areas I sort of like to spend some time with is just the basic operation, foot programming of the programs for the chair, and then also the maintenance. As far as the chair itself, you'll have a foot switch with a center paddle. Up, I'll take the chair up. Down will actually allow the chair base to go down. To bring the patient's head back to the left, and then to exit the patient to the right. Also on the foot pedal, you'll have both a 0, a 1, and a return arrow. The 0 and the 1 are both pre-programmed positions. So let's assuming that I want to bring this chair back to a pre-programmed position as a starting place. I would punch the 1, allow the chair just to go to where it's at. And then once the chair stops, I want to position that to where I want a starting position for my patient before I start working. So I'm going to bring this chair down. I'm going to bring the back down a little bit. And let's sort of assume that this is where I want the number 1 position to go every time I hit that number 1 button. I'm going to push in on the number 1 button and hold down until the chair beeps at me. And that's where that chair will go each time I hit the number 1 program button. 0 is on the other side of the foot control, and 0 normally is an exit position. Right now, this chair is going too high for the patient to exit, so I'm going to go ahead and stop it. I'm going to bring the chair base all the way down. Bring the chair back up. As an exit position, I'm going to now push and hold on the 0 button until the chair beeps at me. And that's where it'll go each time that I hit 0. So as of right now, I've got the number 1 and the number 0 both programmed. You have also one more function on the foot switch, and that's the return arrow. I'm going to hit the number 1 and allow the chair to go into the operating position that we programmed. And then the scenario might be that I'm with this patient for 30 minutes, but I, as the operator, need to get up and maybe go check a couple of hygiene patients, or I'm going to be out of the treatment room for more than 5 minutes. I want to bring the chair back up so the patient can rest in an upright position while I'm going. And then when I come back into the treatment room, if I hit the return arrow button, it will go right back to where that last position was. But this is just a temporary memory. It will only remember that position once, but it is an item that can be used that once you trim a patient to a particular operating position, you can leave, let the patient rest, hit the return arrow button, and go right back and not have to retrim the chair. Several other functions of the Series 5 chair is you do have a handbrake, which will allow the chair to rotate 30 degrees both directions. Where this is normally commonly used is, let's say I want to work and get more behind on a 12 o'clock position. Maybe I'd want to move the patient a little bit to the left to where I could get more space between myself and the rear cabinet. The other two functions that happen are both armrests. They both will come out 90 degrees and then back. As far as normal care of your upholstery, barriers are still going to be the best way to go to assure the long life of your upholstery. If you do wipe it down with any disinfectants, our recommendation is once a week to wash the whole upholstery down with Murphy's oil soap. Your alcohol will extract the oil out of the outside of the analogous material, and that's where you get the hardness and the cracking that'll happen. But the Murphy's oil soap is not greasy, but it will impregnate those pores with a little oil, so over a period of time what you're doing is offsetting the drying effect. Two problems that I see that occur with the Series 5 chair, and most of those are just, it might come from cleaning or just not understanding. There is a on and off power switch, so if you come in the morning and for some reason your chair is not operating, there is a green light that's on the lower front section of the cantilever section, and that light needs to be on. It might have been the night before somebody cleaned the chair down and hit that switch and shut the chair off. So just make sure that the green light is on, which feeds electric to the chair. The other issue that I've had is if somebody will get something stuck up underneath the bottom of the chair, there's two safety switches that'll actually make the chair either go up, or if it gets low enough, will stall the chair out. So if for some reason you're getting beeping sounds from the chair and it's just not moving, check the safety switches just to make sure that both of them are functioning properly.